all, congratulations to the League of Cities and the League of Municipalities, together with UNFPA, for sponsoring this very laudable activity. And also, I want to greet my former boss, Secretary Cabral Ma'am, the Yusek De Leon of Forum, my colleagues from Public Health, and the Honorable Congressman Bello, a very staunch RH advocate of the House of Representatives, my fellow reactors, and also the presenter of the study on the highlights of the cost-benefit analysis, Dr. Leonardo Lanzona Jr., and our participants, the Honorable Mayors from the League of Cities and the League of Municipalities. So I'll be reacting to the presentation of Dr. Lanzona. And the Department of Health, as we all know, is the nationally mandated national agency which sets policy directions and standards in terms of health programs and health services. And with the present setup, we're in the front line in terms of service delivery. The frontliners are the local government health facilities headed by the local chief executives. So much changes have happened that will spell a difference between what is considered as more accessible, quality standards, health services that should be accessed by the Filipino people. The highlights of the study really mirrors most of the past studies done in relation to particularly maternal and reproductive services, and in particular highlighting family planning. The reproductive health services includes both maternal health and family planning. Way back when the concept of reproductive health was not yet a part of the Department of Health, we have already well-developed programs in the field of maternal health and also family planning. Family planning is a standalone program way back when it was not yet devolved, but it was included as part of the health services that are now part of the local government units. So the big difference now is that in terms of really making sure that the services are delivered to our clients, to the members of the communities, local communities, the political commitment, the support, the statement, the policy support of the local chief executives matter most. The national policy on family planning mandates that all forms of family planning methods under the so-called modern family planning methods, which include the natural family planning methods, should be accessible to the clients who need the services. This should be made available whenever they are needed, particularly to the poor women of reproductive age. In the Philippine society, most of the family planning users, as reflected in the series of family planning surveys that were conducted and in different years, it will always show that the burden of family planning practice was mostly placed on the hands of women of reproductive age. In fact, that's even why one of the reasons why there's a highlight in terms of men's participation, improving men's participation in the field of reproductive health, not only in family planning. And I agree with the findings also of the study that says that the correlations of the different factors, that it's not only in the same manner that family planning is not only delivered in the context of health intervention, but also as part of poverty mitigation. That is how we, in terms of policy of the Department of Health, it is not only limited as before that there was some connotation that it involves limiting the number of children, but now it is in the context of health intervention that is expected to assist poverty mitigation at the family level. So the context of family planning program at the Department of Health is on preventing high-risk pregnancies, so eventually reducing maternal deaths, which is part of our commitment to the Millennium Development Goals by 2015, and also responding to unmet needs. There was a mention about unmet needs in the study conducted, and attaining desired family size. So this will involve not only limiting, so there is an unmet need both for limiting and for spacing. So it is a wrong notion that family planning only entails limiting number of pregnancies, but it also includes achieving pregnancies, meaning for those who don't have yet the complete family size, these can be assisted by the family planning program. So in terms of the policy recommendations that came out, like for example, improving family planning and the maternal and reproductive health programs, the present administration, under the Aquino Health Agenda, with the catchy line of kalusugan pangkalahatan, under the Universal Health Care Strategy, this has been given priorities as one of the priority strategies of achieving universal health care. So we have now three main strategic thrusts of financial risk protection, and that means trying to achieve universal coverage in terms of PhilHealth enrollment, but in particular, giving priority to those who are belonging to quintile 1 and 2, quintile 1, the very poor, and the quintile 2, the near poor. Then another strategic thrust is improving access to health services. This includes family planning and all health-related, MDGs health-related programs, which include family planning, by means of improving and upgrading health facilities, improving human resource capacities, and ensuring access to essential commodities and other supplies like family planning supplies. We are trying to introduce the policy of trying to classify family planning commodities as essential commodities, and which means inclusion, ensuring inclusion in the so-called Philippine National Drug Formulary as part of the essential drug list. Why is this so important? Because in terms of the national procurement law, local government, national government will not be allowed to procure commodities, particularly medicines or health supplies, which are not included in the Philippine National Drug Formulary. And that is the very reason why we have tried to include some preparations available in the market to expand access to different contraceptive or family planning preparation. Then we have also adopted the so-called sector development approach for health, which is ensuring that the local government's program, their plans, is aligned with the national health program, so that there will be harmonization and convergence of the different priority programs of government. And that is the main reason why lately there was a joint memo signed by national agencies. There is a convergence of national agencies under the cluster of human development and poverty reduction cabinet cluster, chaired by no less than the DSWD Secretary Linke Suliman, and with an agreement with the Department of Health, DILG, Department of Education, the so-called community health team mobilization. I think this is one of the strategic thrusts of government in trying to really ensure that services, social services, that's why we have converged, these 4 departments have converged, so that there will be alignment, convergence of services to be delivered to those who need it most, like the poor, the poorest of the household. But it's not only the poorest of the households, but we will be covering, the coverage will be national, but prioritizing first on the 12 provinces, LGUs, with the most number of CCT beneficiaries. So this convergence, the community health team, by the way, will be headed by a health provider. It's either a nurse or a midwife. The members of the community health team will be composed of volunteer workers at the level of the community. This will be a representation coming from the health sector, like barangay health worker, from the National Nutrition Council, the barangay nutrition scholars, and we have included, if possible, give priority to traditional birth attendants. Because with the recent paradigm shift, wherein the national government, the Department of Health, is advocating for facility-based deliveries, and we are discouraging home-based deliveries. Because it has been proven, there are lots of evidence in the health field telling us that reduction of maternal mortality will not happen the way we expect it unless we can assure that mothers who are delivering can have access to emergency obstetric and newborn care. So that is why the paradigm shift will happen through the advocacy of these community health teams, wherein they will be going around the household to household in the areas where they are assigned to the different households and doing the master listing, pregnancy tracking, and who of the members of the families will need health care. And they will try to connect these families to specific health facilities to ensure that since we are creating demand in terms of demand for their entitlements in terms of health, demand for their entitlements as PhilHealth members, then we should ensure that they have connections to the appropriate health facilities. So, from the context of ensuring sustainability, way back 2004, the Department of Health issued a policy, the so-called contraceptive self-reliance policy. That was an answer to the phasing out of donated USAID contraceptive commodities. They were donating to the Philippines about an amount of $4 million per year in terms of contraceptive commodities. Since there was already a phasing out, meaning these donated commodities will no longer be made available as donations to the LGUs, the Philippines, the government should prepare a transition so that there will be no disruption of delivery of family planning services in the different LGUs. But like all policies wherein it's not a perfect policy, despite the preparations that we have introduced in contraceptive self-reliance, there are still municipalities who were not able to undergo the transition, to take care of the gradual phase out so that they can take care of the commodity requirement, particularly for poor clients. So during the stewardship of Secretary Cabral, there was an amendment to that policy. I think, ma'am, it was way back 2010, wherein we welcome donated commodities, but with a colatilia that this should be intended for the poor beneficiaries. So from the Department of Health, we have constituted the so-called mentioned grants, the Maternal Newborn Child Health and Nutrition, that is the acronym for MENCHAN. It's a new policy of convergence, of integration of all maternal and child health services, which encompasses the different elements of reproductive health. There was a mention that integration will improve service delivery, will improve compliance by our clients, since it will lessen missed opportunities. And that missed opportunities was related to the cost-benefit analysis, which will ensure increased savings on the part of the service providers and also the financiers for these different programs. So with that mentioned policy, that is now an integrated policy adopted at the local level in the context of integration. I think that's about all. Sir, thank you for your studies. Thank you.
Thank you very much, Dr. CATIBOG.